Our today's lecture is about the nomenclature of skeletal muscle, and we will go through all the criteria that we use to classify or that we use to name our skeletal muscles. The first criteria is according to the shape of the muscle, and a muscle may be named according to its shape, and the examples include trapezius. That means the muscle would have a trapezoid appearance or shape. Teres means a rounded or cylindrical shape. Rhomboid means a diamond or rhomboid in shape. Latissimus, widest and broad in appearance. Rectus, a straight muscle. Serratus, a muscle would have saw-like appearance. Lumbricus muscle, that means the muscle would have earthworm-like appearance. Previously, we have talked about the teres major and teres minor muscles, and in our next slides we will go through these muscles once again, and we will appreciate the appearance of these muscles. Rhomboid, we will look at the rhomboid major muscle as well. Latissimus, we will look at this muscle as well. Rectus, we have previously talked about the rectus abdominis muscle, and we saw the arrangement of muscle fascicles. They were parallelly arranged, and the muscle had a straight appearance. Serratus, we have previously discussed about the serratus anterior as well. That was the muscle of your rib cage, and it has a saw-like appearance. Lumbricus muscle, we have talked about these muscles as well, and we saw these muscles in the palm of your hand and also in the foot. So these muscles basically have earthworm like appearance. These are the muscles according to the shape, and starting from the left, I have already encircled the muscles, and these two muscles that I have encircled are the teres minor and teres major muscle on the left, and you can see their appearance is cylindrical. The next muscle that I have encircled is the latissimus dorsi muscle, and this muscle has a very broad or widest appearance. So latissimus means widest or the broadest appearance. The next muscle that is highlighted with green is the rhomboid muscle, and you can see its shape. Its shape is more like a diamond or rhomboid. That's why we call it rhomboid major muscle. The next that we have already discussed is the serratus anterior muscle, and we have previously discussed about its function as well, and you can see its appearance. Its appearance is saw-like. The next criteria that we use to name the skeletal muscle is on the basis of location. Pectoralis, whenever you find a muscle with the prefix pectoralis, that means the muscle will be located in the chest area, and we have already talked about the pectoralis major and minor muscles, and those muscles were located in the chest area. Brachia, that means the muscle would be located in the arm, and previously we have discussed about biceps brachii muscle. There is another example, that is femoris muscle, which will be located in the thigh, and the example for the femoris muscle is biceps femoris muscle. That would have two tendons just like biceps brachii muscle, but the brachii muscle will be located in the arm, while the femoris muscle will be located in the thigh. The last example is temporalis, and we saw the temporalis muscle as well, that had fan-shaped appearance, and we saw that the temporalis muscle was located in the temporal region of the skull. The next is on the basis of the size. So we can classify the muscles on the basis of their size as minimus, medius, and maximus muscle. If the muscle has the smallest size, then we will name it as minimus. If the muscle has medium size, then we will name it as medius. And if a muscle has largest size or large size, then we will name it maximus. And if we take the example of gluteus muscles, then we can classify them according to their shapes as gluteus minimus, gluteus medius, and gluteus maximus muscle. You can see in this diagram the B muscle, which is the most superficial muscle of the gluteus muscles, and this muscle has the largest size. And if we dissect this muscle, then we can see the gluteus medius muscle that has medium size. Then comes the gluteus minimus muscle, which is deeply located, and if we cut the gluteus medius muscle, then we can see the gluteus minimus. So this classification was on the basis of the size. The next is on the basis of the number of heads, and if a muscle has two tendons, then we will name it biceps, just like we previously studied the biceps brachii muscle. The muscle had two tendons, and that was the muscle of your anterior compartment of the arm, and it had properties of agonist, and that was causing the flexion at your elbow joint. Triceps muscle, this muscle would have three heads, and triceps brachii was the muscle of your posterior compartment of the arm, and we studied that the triceps brachii muscle basically has antagonist properties, and that was causing the extension at your elbow joint. The next is quadriceps muscle. This muscle would have four heads, and we have an example of quadriceps femoris muscle, and I have pasted a diagram here. You can see the four tendons highlighted as blue, green, yellow, and red colors. And basically quadriceps femoris muscle is a group of four muscles, and these includes the vastus lateralis, vastus intermedius, vastus medius, and the rectus femoris muscles. You don't have to remember the name, I'm only telling you to make your concept clear. The last includes multicipital, and the example is serratus inferior muscle, arises by 8 digitations or heads. So we not only name the serratus inferior on the basis of its appearance or shape, but we also name it on the basis of its tendon, and this muscle has 8 digitations or tendons. So this muscle is a multicipital muscle. The next criteria that we use to name our skeletal muscles is origin and insertion or attachments. So according to the attachments, we have two examples here. Coracobrachialis muscle, that is attached to the coracoid process of the scapula and gives its insertion to the humerus bone. The second example is sternocleidomastoid muscle. As the name says, this muscle would give attachment to the sternum, clavicle, and mastoid process of the skull bone. Let's see these muscles in the diagrams. The one highlighted in green is the coracobrachialis muscle, and this muscle is arising from the coracoid process of the scapula, and it is giving its insertion onto the humerus. The next muscle is the sternocleidomastoid muscle, and this muscle is one of the largest muscle of your body, and you can feel it on the lateral aspect of your neck. and this muscle is arising from the sternum clavicle and giving its insertion onto the mastoid process of the temporal bone. Uh, the mastoid process is basically a part of your temporal bone, and you can feel it behind your ear. To make your concept clear, I have pasted a diagram showing the mastoid process, and the mastoid process also contains the ear cell, which helps in communicating with the middle ear. So I will suggest you to feel this process behind your ears, and also the sternocleidomastoid muscle. Another important thing is that the sternocleidomastoid has two functions. It helps in opposition of your head, and also it helps you in bringing your head forward, which is the flexion at the neck. And if you move your neck posteriorly or backwards, that would be the extension at your neck. But the sternocleidomastoid muscle is responsible for the flexion or the forward movement of your neck. The next is on the basis of the direction of muscle cells. Once again, the rectus, the muscle fascicles, we have already discussed about it, that in the rectus abdominis muscle that we previously saw, the muscle fascicles would arrange longitudinally or parallel to the axis of the pull. In the transversus muscle, the muscle would be composed of transversal, or the muscle fascicles would be oriented in the transverse appearance. Obliquely arranged muscle will be in the oblique muscles. The next criteria is on the basis of the gross morphology, which means the appearance of the muscle that you are able to appreciate with your naked eye. And the examples include semi-membranosus and semi-tendinosus. And semi-membranosus would have partly membranous appearance, and semi-tendinosus would have partly tendinous appearance. And you can appreciate in this diagram, I have inserted it, and the semi-membranosus has partly membranous appearance, and the semi-tendinosus has partly tendinous appearance. The next is on the basis of the action of skeletal muscles. So depending upon the main actions, the muscle could be named, and examples include supinator muscle and pronator muscle. Supinator muscle will cause supination of the forearm, and pronator muscle would call pronation of the forearm. So what basically is supination and pronation at your forearm? These are basically the movements that occurs in your forearm, and the supinator muscle is responsible for the supination, while the pronator muscle is responsible for the pronation. And supination will be a state of your hand when your palm is facing anteriorly, while the pronation will be the state of your hand when your palm is facing posteriorly. You can already also make your concept clear by remembering this, that the supination will happen when you are asking someone to give you something, while the pronation is a state of your hand when you give someone something. So this was on the basis of the action. And last criteria is the combination of various criteria. Following examples illustrate this criteria of the naming muscle. Pronator teres is the first example, and we have already talked about the pronator muscle that was causing the pronation at the forearm, and by the action this muscle is a pronator, and teres will be according to its shape, that was cylindrical. So this muscle, according to the action, is a pronator, and according to the shape it is round or cylindrical. The next example is flexor digitorum profundus. Flexor means by action it is a flexor, and digitorum means that this is a flexor of the digits, and profundus means deeply located. So according to the action it is the flexor of the digits, and according to the location it is deeply placed in the forearm, that is profundus. So profundus means a muscle that is deeply located. The last example is adductor magnus muscle, and by the action this muscle is the adductor of your thigh, and magnus mean by this is a large muscle according to its size. So it is the adductor of the thigh by the action, and it is the large in size as compared with other adductors, that is magnus. So that's all for today. I hope you have understood this lecture. If you have any question regarding this lecture, then you can ask. Thank you so much.